Hi, and welcome to today's presentation. Today we're going to be talking about cognitive processing therapy, or CPT in brief. Now, we've done other presentations on cognitive processing therapy, and that's for the whole 12 to 13 session shebang. What we're going to talk about today is something that's more useful sort of in a active environment, some sort of quick interventions that people can use, geared more towards echelon 1 type interventions. What we're going to do today is define trauma and PTSD, explore the function of PTSD symptoms. We'll then examine the risk factors for PTSD, identify prevention strategies, develop cognitive processing tools to deal with traumatic events. You notice I say tools because if you're not doing the entire 13-session thing, it's not actually cognitive processing therapy. We're taking some of those tools that can be useful in an acute environment and implementing them in order to mitigate the reaction and hopefully head off any later problems. And then we'll discuss how field supervisors can use these tools to mitigate the impact of traumatic events. Now, CPT was originally developed for military use, but it also can be used in fire rescue, emergency departments, law enforcement, anywhere where people might be exposed to acute trauma. So let's go ahead and move on. What is trauma? Trauma can be thought of as an event that injures a person in some way. So think about physical trauma. We've all talked about that before. We've all experienced that before. When my daughter fell, she cut her knee, and it was traumatic for me. But the trauma itself, the physical trauma, required her to have stitches. So when we have a physical trauma, our body initially is broken or injured, but it repairs itself. The same thing is true with emotional trauma. Everything our body does, everything our brain does, is geared around homeostasis. It wants to protect us. It wants to help us survive. So when we're talking about traumatic experiences and PTSD and all these things, those are clusters of symptoms. Those are experiences. But we do need to remember that the body and the brain do have the ability to recover. It's not some long-standing, forever badge that you're going to wear most of the time. Now, there are certain things like traumatic brain injury that will have a lasting impact. You know, you can't undo some things. But the cool thing is your body learns workarounds. Your body learns to adapt and adjust so you can take on most of those other activities that you did before the injury. Trauma is an unusual occurrence. You don't split your knee open, you don't break your arm, you don't get into a car accident every day. These are unusual incidents, and your body goes, whoa, okay, got to figure out how to deal with this. Now, sometimes, and we'll look at the physical trauma first, sometimes the healing goes a little bit wonky. You may get an infection, or if you've ever had scars that have healed, but they've been really, really sensitive, or they've been raised and red, and doctors have all kinds of terms for those, but basically it doesn't knit the skin back together quite the way you would have hoped. The good thing is, again, there are treatments that can help smooth out those scars and make them more like the skin around them. The same thing is true with emotional trauma. Not always, but sometimes people don't have the automatic healing response that we would hope they would have. Sometimes things go a little bit wonky. And what we're talking about here is figuring out ways to try to prevent or minimize the amount of wonkiness when, we'll keep going back to this physical trauma. When you have surgery, the doctor tells you how to care for your wound in order for it to best heal, in order for the scars to be minimal, etc. And depending on your doctor, that kind of changes a little bit. But there are certain protocols that you'll follow in order to make sure that happens. That's what we're doing here. We're trying to help people take care of their wounds, use the tools and skills that they have in order to prevent a longer term or more chronic trauma. So again, people heal from trauma. The other thing that I want to point out here, because a lot of what we talk about here at AllCEUs and in clinical circles is PTSD and trauma. That's because people who come to see us aren't your happy-go-lucky, healthy people who are walking around going, I've got life by the tail. We're dealing with people who are presenting with issues. A lot of times that's PTSD. But it's important for people to recognize, one, that people that are encountering trauma, recovering from trauma, soldiers that are coming back from war, from being deployed, may have a wide array of mental health or substance abuse issues, but the majority don't. The majority, once they get past that acute reintegration period, they're fine. So I don't want to pathologize everybody that's coming back from war or every cop that's out there, because it's actually not everybody. There are people who, because of a variety of factors that we'll talk about, may encounter a little bit more difficulty dealing with the traumas, but they too can heal. It's not something that is going to be completely debilitating forever. So PTSD, post-traumatic stress disorder, is simply a cluster of symptoms that may result when something disrupts or prevents the natural healing process. And I want us to realize that PTSD, just like when we say depression or anxiety or bipolar disorder or the flu or diabetes, any of these labels we put on stuff, it's just shorthand. That way we don't have to rattle off all the symptoms every time. It's a term that gives people an idea what someone might be dealing with, what someone might be going through. It's not something that they necessarily have to take on and say, I am PTSD, because you're not. PTSD is a cluster of symptoms. It can result in brain changes similar to those seen in traumatic brain injury. So when they've done PET scans, they've found that people with significant PTSD often do show some brain changes, especially in what we call the prefrontal cortex, or the area up here that's responsible for behavioral inhibition and impulse control and those sorts of things. Just like wounds can heal, the brain can heal. The brain can also find workarounds, which is why when you take tumors out of people's heads, they don't lose everything that was there. The brain figures out how to work around it. Or when people have a stroke, or similar things that may cause some sort of actual injury to the brain. So these changes can be overcome, and they can be mitigated. Subthreshold PTSD, which is near and dear to my heart, because that's what I studied when I was in college, and I've continued to study throughout the years. This is when people are experiencing events that don't necessarily meet that threshold that you might think of for PTSD. They're not necessarily maybe shot or maimed or whatever the case may be, or they don't necessarily fit all of the symptoms, but they have some of them. And any of these symptoms can be really debilitating if it's uncontrolled or if the person doesn't understand what it's trying to tell them to do. So one of the things that we need to look at is, again, stay away from getting too hooked on labels. If somebody is presenting with symptoms that seem to be relatively disturbing to them, and they fall in this PTSD range, then we need to treat them. Hyperarousal, being hypervigilant, being on edge all the time, intrusive thoughts, nightmares, dreams, flashbacks, and dissociative sort of things, avoidance of memories of the trauma. Those are kind of your three categories. If they don't have symptoms in all of them, again, it doesn't mean that because they don't, then we don't need to do anything. It means that they're not having as much difficulty as other people, but we still need to provide them some tools. They wouldn't be in our office, they wouldn't be present with us if they weren't struggling in some sort of way. Because as much as I like to think I'm great to hang out with, people aren't just going to randomly show up at my door and go, hey doc, let's sit down and have a chat for an hour. I'm realistic. So one of the things we're talking about in the PTSD realm and when people experience trauma is the body's natural reaction. The body's natural reaction, again, remember the body is really smart and really stupid sometimes, but we'll stay with smart right now. It says, I don't want to die. I don't want to be injured. So I'm either going to fight if I think that I can win this, or if I don't think other options are available. That can come out as aggression. That can also come out as emotional anger. I am going to flee. I'm going to get the hell out of here because I can't fight, I can't win this, and I just can't take it anymore. It's overwhelming me. That's your fear and your anxiety. Or I don't know what to do. I don't think I can fight it. I don't think I can get away from it, so I'm going to freeze. Now, to make it a little bit more simplistic, think about a cat. And cats tend to be more reactive than dogs, so I'm going to use a cat as an example. When a cat initially feels threatened by some big person, I work with a lot of ferals, and so I've had a lot of experience with this. Initially, they will try to run away. They don't want to fight you because they know they can't win most of the time. If they get cornered, they're probably going to try to fight. At a certain point, if they realize they can't win or they're losing, or some of them just kind of skip the fight part, they may freeze and just be like, okay, just please don't hurt me. Our bodies do the same thing. It's a primitive reaction coming from primitive parts of our brain. It says, protect yourself. This is what some of your PTSD symptoms are trying to do, is trying to help you make sense of what happened and protect yourself in the future. So cluster 1 is your re-experiencing. Flashbacks, intrusive thoughts, and nightmares. The purpose of your cluster 1 symptoms is to help you make sense of it. Most of us do not expect to see people shot in front of us. Most of us do not expect to experience these traumas, whatever they may be. So when we experience those, when we are exposed to those things, our brain goes, what do I do with this? Does it mean the world is completely unsafe? What does it mean to me, and how do I integrate this? In PTSD, we see people who take it sort of to the extreme. Instead of saying this was an unsafe situation, they begin to think more extreme and more globally as the world is unsafe. People are bad. So one of the things that we're going to talk about later in the tools is taking away that global generalization and say, okay, let's look at this situation. Let's look at what happened here. Sure, you don't want to be in that situation again. But is it really generalizable to everything? So flashbacks, the brain's remembering it and going, did this really happen? What could I have done differently? What should I have done differently? This really couldn't have been the outcome, so maybe if I replay it, I'll figure it out. Or maybe if I replay it, it'll remind me not to do that again. Same thing with intrusive thoughts, and that's more of the trying to figure out where to fit it in those memory banks because it doesn't fit. And nightmares, when we're asleep, we don't have as much conscious control over what we're thinking, so people may experience nightmares that hold the same purpose. Again, these are designed to help the person make sense of it and protect themselves in the future. The problem comes in when they make sense of it in a way that is too broad. Cluster 2 is your arousal. Hypervigilance, people who are always on edge, always looking around. If you know cops, you are experienced with this some where anytime you're in a restaurant or in a public place, they're always surveilling. Just always aware. They don't like to have their back to the door. They're always aware of what's going on, preparing, protecting, thinking, always kind of on. That's exhausting. It's exhausting to look at everybody and get everything and constantly have that input. But it also makes people, aside from being tired, it can make you irritable because it's tiring. Difficulty falling or staying asleep. Well, when we're asleep, we're vulnerable, okay? So if you're vulnerable, then that could happen again. And your cluster 2 or your arousal symptoms are designed to protect you. It says, okay, I don't really know how to make sense of this, but I'm going to make sure it's not going to happen again. I'm going to stay aware. I'm going to stay hypervigilant. I'm going to be prepared next time. Unfortunately, that kind of backfires after a while when you're always on and always hypervigilant and you can't sleep very well, because then concentration and impulse control and decision making go out the window. Difficulty concentrating. Hey, if you're constantly surveilling and looking at everything and on edge and you jump every time somebody drops something, guess what? You're not going to have a lot of energy to concentrate. You can also start experiencing irritability and anger outbursts because you're tired and it's exhausting. You have to limit the stimulus input. So how do you do that? You push everybody away. You may withdraw, but you also may push everybody away and kind of be always on that very last nerve. So again, cluster 2 is your protective set of symptoms. Cluster 3, avoidance of reminders. Well, you don't want to remember that. It was one of the worst experiences on one of the worst days of your life. Really? Do you want to remember that? Because you don't want to keep replaying it. And at a certain point, you've just got to stop. And this is where people start to experience emotional numbing, withdrawal, detachment, and avoidance of reminders, whether it be the place. For some people, it's the news. For some people, it's smells. So being aware that there are certain things that will trigger, I hate to say it, but they will, they'll trigger memories. Those triggers are things people are going to start to avoid. And in other presentations on PTSD, I've talked about a cop I worked with who was in a really bad scenario where a tanker truck was in an accident. The driver of the tanker truck was stuck in there. He wasn't able to get the guy out. The tanker truck exploded. Okay, so that's horrific. God help him. One of the things that triggered his flashbacks was the smell of exhaust fumes. Now just think for a second. The smell of exhaust fumes. How do you avoid that? You don't ever drive? You don't ever leave the house? Well, that's no way to live. So he needed to be aware of that and develop some skills and tools to deal with the flashbacks when they came in order to keep him focused in the present and not go back there and start reliving it again. So some of the things that make people more predisposed to having problems dealing with acute stressors include the number of stressors in the prior 6 months. Just like when we start to get run down and exhausted, our immune system goes down, we may not heal as well, it takes longer for everything to fix. And sometimes just as getting older, it seems like it takes longer for everything to fix, but I digress. We want to look at the number of stressors in the prior 6 months, and it's not just emotional stressors. It's not things that people will say, oh my gosh, that stressed me out. We want to look at physical stressors. If people are not getting sleep, and despite what some people say, sleeping is not cheating, we need our sleep, we need our rest, so our body can focus on doing nothing but repairing itself, revitalizing, and rebalancing. You can't really repair, revitalize, and rebalance if you don't have the tools and the parts to rebuild whatever it is. So you also have to have good nutrition. If people are not eating well and not sleeping well, it's going to be harder for them to repair physically and psychologically. Our brain makes all of our happy chemicals, all of our neurotransmitters from foods that we eat. We need to give it the building blocks. Vitamin B6 is a big one. We need to make sure that our body's getting tryptophan. We need to make sure that our body's getting carbohydrates. We need to make sure that our body's getting water. All of these things can help somebody heal, help somebody stay prepared so they're in good form when they may need to heal, and all of these things can hinder if they're not taking care of themselves. We also want to look at social stressors, and this can be everything from your kid having trouble at school to problems in the work environment to problems at home or a falling out with your best friend. And then occupational stressors. And in a lot of situations that I've worked with, one of the greatest sources of reported stress is not the calls that they go on, it's not the events that they experience, even even though those may be very traumatic to some. It's the organizational stress and the dysfunction within the work environment that grates on their nerves and really wears them down more than anything else because it's constant. So we need to look at all those to say, okay, was this person starting at the 50-yard line or 40 yards back? The availability of social support within 2 hours of the event. Why 2 hours? Because after 2 hours, people start to lock it down. In law enforcement, you don't even necessarily have that long, because as soon as the trauma or whatever it is happens, and this is true in some other situations, as soon as it happens, they have to get on to the next call. On the battlefield, you can't have some traumatic experience and sit down and talk to somebody for a little while and then go back out. That's not how it works. Same thing to a certain extent with fire rescue. A lot of times they have a little bit of a break between their calls. But immediately after the trauma, if support is available, that's the time to start talking about what happened. The memories are fresh, they tend to be a little bit more accurate, and you can start figuring out how to deal with them. Once a person's gotten to the point of starting to lock it down, a lot of times they don't want to unlock it. You know, let's just keep that shoved down there by whatever means necessary. I'm fine, I got it, it ain't bothering me. So social support can even just be camaraderie. I got your back, whatever, and then deal with it later. If you don't get it within the first 2 hours, that doesn't mean you don't need it. At the first available opportunity, if social support can be offered, that's great. A lot of times in different scenarios, there are debriefings or decompression sessions where everybody sits down and goes, okay, what happened? And, you know, let's talk about how we deal with this and what went right, what we could do better next time. There's a show that I really used to like. It was done in Canada. It was called Flashpoint. And it was about an SRT, a SWAT response unit, that would go out and they would do their thing. But after every call, they would come back to the station and they would have a debrief. And that was when everybody got to share their perception of what happened. So you got a global picture and you got to figure out, learn from it, and deal with any of the crap that may come up. That's ideal. Doesn't always work that way, where you have the luxury of doing that. Okay, so the number of stressors in 6 months, availability of social support, history of mental health or substance abuse issues. If we know that somebody already has a history of difficulty coping with life on life's terms, or if we know that they have a history of depression, we need to be more attentive to that, because that could mean, doesn't always, it could mean that they may be more likely to have difficulty dealing with extreme stressors. Similarity to the victim. Now, this is more true, if you will, in law enforcement, fire rescue. If they're going to rescue a toddler and they have a toddler at home, it may hit home stronger. If the person reminds them of them, it may hit closer to home. Now, in the military, there's a little bit of a caveat sometimes, not always, because generally the soldiers are fighting other soldiers that are of similar age, that are similar to them. Many of them report that doesn't bother them as much as when they have accidentally shot, have on purposefully shot, or have witnessed the killing of children or women. So it's what's meaningful to you and what your purpose is there. They rationalize, if you will, or make sense of it, that the soldier on the other side made the same choices that they did. So there tends to be less guilt in a lot of cases. Not always. This is not a global statement by any means. But that similarity to the victim, we don't want to just say, you weren't similar to this victim, so why are you having trauma? Or likewise, you were similar to this victim, so why aren't you having trauma? they may be able to make sense of it in their own mind in a way that is doable. And that's great. If it works for them and it helps them deal with whatever they've got to focus on, whatever they've got to face, that's awesome. And then proximity of the event to the safe zone. When you're dealing with law enforcement, fire rescue, people who are sort of on the home front, if you will, they have certain areas where they live, and then that zone that they're responsible for taking care of. When things happen there, oftentimes, not always, but oftentimes, it is more impactful than if it happened in somebody else's zone or in somebody else's neighborhood, maybe even in a neighborhood that wasn't even like theirs. So it's important to be aware of this. In military situations, the closer it is to wherever you are, the more stressful or the more likely to develop a traumatic reaction it could be. If you are 5 miles back from the front lines, it may not be as impactful if something's going on 5 miles away. But if you're 5 miles back from the front lines and a bomb hits within your camp area, that's like, oh crap, I'm not as safe as I thought I was. So that illusion of safety is all of a sudden shattered. So our basic human fears, everybody has them, whether you want to admit it or not. And a lot of your anger and anxiety, because anger, remember, fight or flight, it's how you appraise the situation, comes from more or less these things. Death, fear of death. Now, two ends of the spectrum, being in war, getting run off the road or cut off in traffic by some stupid person. Either one could theoretically have caused the person to die. You could be in a car wreck because you got run off the road, or, you could get shot or something. The reaction is going to be different. Obviously, this person over here who got run off the road or cut off is not going to have necessarily the same stress reaction as this person over here. But we do need to realize that there's an underlying self-preservation, that was not a safe situation, reaction. Loss of control. Some of us, are a little bit more of control freaks than others. So some people deal with spontaneity and ambiguity a little bit better than others. But to a certain extent, we want to know that we've got control, that we're able to protect ourselves. The unknown. Again, going back up, if you're a control freak like I am, you don't like the unknown either because you can't control something you don't know about. Some people are better equipped to deal with that temperamentally. Some people are better equipped to deal with that skills-wise. Either way, the unknown. If something is anxiety-provoking, you're getting ready to go out, and this was one of the things that came up in one of the Department of Defense best practices that talked about one of the biggest sources of stress for soldiers coming back that they reported from the Iraq and Afghanistan wars was a fear of the unknown. They didn't feel like they were adequately prepared to deal with whatever they were going to face over there. And there were a variety of reasons for that. The unknown is present, in civilian circles too. When you go to clear a building because there's a bank robber or whatever, there's a certain element of the unknown. So that can be stressful, and it can provoke stress reactions. Failure. Some people handle it better than others. What does failure mean to you? Is failure a learning opportunity? Or is that taken as a global ding against your self-esteem or self-worth? Rejection. Rejection is something we also, as humans, we are a group-oriented people. We're not meant to be hermits out in the mountains and living by ourselves. We are meant to be social creatures. So rejection, we don't deal with quite so well. When we're rejected, I mean, let's think about it from an evolutionary perspective. There has to be at least 2 people in order to keep the species going. So if you're rejected and you're isolated, the species is going to fail to thrive, and that's not what we want, which takes us to isolation. So these are our basic, very primitive human fears. When we talk to people who are having stress reactions, who are having anxiety issues, who are depressed, a lot of times we'll find that their thoughts and their interpretations of events are extreme and often centered around these basic human fears. So by adjusting their perceptions that they have no control over everything, for example, or no control over anything. Well, most people have some control over something. It's just figuring out what it is you have control over and then figuring out how to let the rest of it go. That's the whole serenity prayer in recovery. Well, not the whole, but you get the idea that we can take something that somebody's kind of overgeneralized and help them see it in more, in a better perspective. So prevention strategies. I'm going to beat this one to death. Sleep. You need sleep. Your body needs to recover. When you're sleep deprived, your decision making is often poor. Your ability to concentrate is disrupted. Your body's ability to repair itself, your immune system gets, thrown out the window. Everything seems 10 times harder, which means you have to exert more energy, which means you have less energy for anything else. You need to sleep. And good sleep, too, not just, I'm going to take a 15-minute cat nap. Good REM cycle sleep. That's not always possible. If you are a firefighter that works a 24-hour shift, you may be up all night. You may have call after call after call, and there's nothing you can do about that. Okay, that's one day. You need to catch up. You need to get yourself rested before your next shift, hopefully. In military situations, if you're deployed, you may not be able to get good sleep for days or weeks on end. It is important, as from a prevention standpoint, to do whatever you can to try to help people get as much quality sleep as they can, and take what they can get when they can get it. Nutrition, vitally important. Drink plenty of water. Lack of water leads to feelings of fatigue, concentration difficulties, foggy head, which also can hurt work performance, among other things, and put people in a situation where it's harder for them to make the right decisions and deal with anything that comes their way. Social support. When a trauma occurs, we need it, but you don't just suddenly make friends after a trauma. We need to have social support, camaraderie, bonding, unit cohesion, whatever you want to call it, before this happens. That way people can say, John, you're seeming like you're struggling, or you're having a really good day, or John, I just need to vent for a few minutes. Can you listen? And I realize most people are not going to have that discussion. They're just going to be sitting around, and all of a sudden somebody will start spewing something, and that's okay. The girl thing is more, and sorry anybody I offended, but women tend to ask permission before they start going off on a rampage. Oh my gosh, let me tell you about, may start it. But we do need to have that social support, and it needs to be sane, sober social support. Let's not be using people who are having difficulty with life anyway as our only social support mechanisms. Let's make sure there are people, chaplains, counselors, supervisors, friends, whoever is appropriate, that can be a good sounding board. Most people just need a good sounding board so they can get some perspective. That's what it comes down to. Stress management. Remember, we talked about risk factors, stressors in the prior 6 months. If we can help people manage those stressors, then they're going to be less exhausted anytime they encounter a trauma. And positive activities. Laughing releases endorphins. Positive activities helps with unit cohesion and bonding. People need to feel good sometimes, or they're probably going to start getting depressed. So let's incorporate some positive activities. And it can be practical jokes, it can be football games, it can be shift parties. There's a variety of things that it can be, but you don't want to have every social interaction or every interaction and thing the person does be stressful and drudgery. It wears on anybody. So cognitive theory. As you were growing up, you learned about the world and organized it into categories or beliefs. So you experienced something, stove hot, don't touch, was filed away. So now if you go to the stove and you see that the burner is red, most of us are not going to go, oh, let me put my hand on that. We're going to go, stove hot. I remember that from when I was, 18 months old or whatever the case may be. This is how we make sense of the world. This is how we interpret the world. Now, for people who've had different experiences, and I've used this example before, I know, but one of my dear friends, and I do it too, I speak with big gestures. I am constantly gesturing. And it's not because I'm angry, it's just because I'm excitable. But somebody who has come from an environment where there was a lot of domestic violence or a lot of anger, they may take big gestures to be intimidating. When I worked with little kids in community mental health, I did have to be cognizant of the big gestures I made, because not only do I make big gestures, I'm also loud. So, I'm scaring these little kids. You've got to be careful. Even though I wasn't intending it that way, their learning experiences said when a grown-up gets loud and starts flailing their arms around, run. And that's the last thing I wanted. So cognitive theory, again, says prior experiences help us learn how to interpret events. When an unexpected event occurs, it may not fit your beliefs. So there are a couple different things you can do with it. You can change your memories or interpretation of the event to fit with your pre-existing beliefs. So you can assimilate it into something that would make sense or something that you can deal with. Or you change your beliefs to accept what happened, which is accommodation. You change your beliefs from this was a dangerous situation to the whole world is dangerous. I can't go out after dark. See the difference? This was a dangerous situation. It did happen after dark, and I need to take these steps to protect myself versus I cannot go out after dark because it is too dangerous. Much more limiting. There was an episode of MASH, and I'm dating myself by bringing that up because I don't think it's even been on in syndication for a while, but where Hawkeye was talking to the psychiatrist, and he had been having a hard time dealing. And he was telling the psychiatrist about this time they were on the bus, and they were riding along, and they picked up some refugees that were on the side of the road. But then the enemy was somewhere around, so they had to pull the bus off to the side of the road and hide behind the bushes. During this time when they were hiding, he remembers this one refugee woman had a chicken with her. It just kept clucking. It just kept clucking. And he was like, you've got to keep that chicken quiet. Well, lo and behold, eventually she quieted the chicken, and the chicken was suffocated. If you know any chickens, you know that they don't just take to shh, no clucking very well. Well, anyway, as the story goes on, the psychiatrist is like, really, a chicken? And this is causing you this much upset. Suddenly, Hawkeye remembers it wasn't a chicken. The woman had a baby with her. And he told her to keep the baby quiet, and she inadvertently smothered the baby. That's not what he intended. And he couldn't deal with the fact that he blamed himself for her smothering the baby. So he changed the memory to a chicken. A chicken was something he could deal with. A chicken was something that he didn't feel so bad about. But in the back of his mind, he still knew somewhere back there, obviously because he remembered, that it was a baby. So this is how our brain works. It's kind of cool. It says, yeah, you can't deal with that yet, so I'm going to make this a chicken, and then when you're ready, we can talk about what really happened. Unfortunately, that means our memories are not always 100% accurate. The good point is, if we go back and look at what happened and talk about it, we can often figure out exactly what did happen. Most people, when they're remembering situations, you know, your armchair quarterbacking, hindsight's 20/20, whatever phrase you want to use, it seems like you should have been able to do X, Y, and Z. Or why didn't you think of doing these things over here? Because now you're thinking about it with a clear head. Your life's not in danger. You're not in the middle of an adrenaline rush. Then you had other things going on. Maybe there were 15 people around you that wanted you dead. Well, that's something to kind of impact how you're making decisions. So one of the things that cognitive processing therapy does is it encourages people to remember the situation in its totality. It also encourages people to use logical reasoning, not emotional reasoning. Emotional reasoning is when you say, well, I feel like I should feel guilty about this, therefore I must have done something wrong. There's no concrete evidence. There's no logical evidence. There's no proof. There's no fact. You're basing everything on a feeling. You know, we have to deal with those feelings, but we also need to put them into context. So with CPT, cognitive processing therapy, one of the things we want to do is have people retell the story and beliefs about why it happened. So tell me what happened. Pretty simple question. From there, we can get an idea about the parts that they're discounting. And usually it's the rest of the situation. They've got this tunnel vision. I did this, he did this, I did this, he did this. Well, what was going on around you? Where was your backup? What was going on the radio? What were all the other factors that you were not only having to pay attention to, but factor in at that point in time? And then we start looking at the beliefs about why it happened and what they should or shouldn't have done. What is your evidence? Give me some facts here. What is your evidence? What are the facts that support your beliefs? Are you focusing on the whole event or just a little part of it? When we look at after-action shootings, a lot of times what the media focuses on is that 2, 3, 5 minutes right around the shooting. Most of the time, there's 20 or 30 minutes leading up to that that we really need to take into consideration. There may be other safety factors that need to be considered. Are you considering all the factors? What else was going on? What went into your decision making at that point in time? Are you thinking in all or none or extreme terms? The world is dangerous, or the situation is dangerous. And again, are you using emotional reasoning? Are you basing your feelings, thoughts, and reactions on a feeling without any verifiable facts? So when you're in the field, and this is, sergeants, supervisors, anytime after an incident happens, people need to be aware that traumatic events will affect people differently. It's ideal, regardless of what kind of situation you're in, to have a debriefing after stressful events. In community mental health, we don't necessarily have what you would consider traumatic events. We have what they call vicarious trauma. We hear the worst things that happen to people on the worst days of their lives a lot of times, and we hear a lot of it. So when we would have our staff meetings, we would have debriefings about what was going on, how people were dealing with it, etc. So that was the time where we would do our our debriefing. It wasn't as acute, but it did give us a chance to gain perspective kind of on what was going on and get some feedback and support from our peers. In law enforcement, fire rescue, emergency room work, military, if there can be a debriefing, in a reasonable period of time, and I use that term very loosely, it's extremely helpful. That way, everybody has similar rendition of what's going on. Now, in an after-action shooting, people aren't going to be able to talk to each other. That's just kind of the way it goes. But it's good if everybody involved has access to someone who has privilege that they can talk to about the event to at least start trying to make sense of it in their own mind. The earlier we get to this, the less likely people are to develop PTSD. Now, I keep talking about develop it. PTSD isn't diagnosed until, a month or 6 weeks in the future. The first month to 6 weeks, it's called acute stress disorder. Acute stress disorder is a pretty normal reaction to acute stressors, to really traumatic events. So we don't want to label or pathologize people too soon. We just want to say, okay, what do we need? What tools do you need? What assistance? What feedback do you need? So your body and your mind and yourself can heal from this and have no problems. It is something that can be done. And the more frequently we engage in these discussions and let people know it's okay to just kind of put it all out there. And putting it all out there, I know some of the people watching this right now are like, oh, I'm not going to talk about all that touchy-feely. That's okay. One of the things that you want to be aware of, and one of the things that you want to encourage, is even if it's not within your team, maybe, people go home and de-stress with their wife or de-stress, with their best friend, hopefully not at a bar. People just need to get it out. You can't keep so much stuff locked down forever before eventually the pressure builds up and it's overwhelming. So PTSD is a response that may develop in response to abnormal events. These are things you're not ever expected or supposed to really have to see or experience. Events that cause PTSD are often so overwhelming, they prompt overgeneralization and extreme thinking. This is our reaction to something that was threatening our safety, our life. It's like, okay, I'm going to make sure that I've got a really wide berth around anything like this so it never happens again. These reactions can cause the world to be perceived as a much more stressful place. If every time you go out and you see somebody that meets a certain criteria and it kicks in your stress reaction, and cops, you know what I'm talking about, military, you do too, then the world is going to be a much more stressful place because you're going to see, not everybody who meets this criteria is a bad guy. By addressing thinking errors and placing events into context, the person with PTSD can often greatly reduce their symptoms and start dealing with things as they come and lead a happy, healthy life.